Hi, my name is Dr. Ann Manny, and I'm a cardiologist with Austin Heart Lakeway. I grew up in Pennsylvania. I recently moved to the Austin area. I'm excited to be here. I went to medical school at Johns Hopkins Hospital in Baltimore, Maryland, and then I did my internal medicine residency at Columbia University in New York City. I then did my cardiology fellowship at Thomas Jefferson University in Philadelphia. I got into cardiology because when I was undergoing my internal medicine training, I saw that there were a lot of opportunities in cardiology to actually help and treat patients. There were a lot of things we can actually do to make patients feel better. I see patients for a variety of cardiac conditions. I can treat general cardiology issues, such as if patients are having symptoms like chest pain, chest discomfort, shortness of breath, or palpitations. I also see patients for specific cardiology issues like coronary artery disease, if they have a history of heart attack or have a history of stents put in their coronary arteries, or if they have had a history of bypass. I also see patients for valvular heart disease, such as aortic stenosis and mitral regurgitation. I can also see patients for heart arrhythmias. I also specialize in treating women with heart disease, not only to prevent heart disease, but if they do develop heart disease, to try to work with them to see what works best for them. I also have a special interest in seeing young women who are pregnant and may be asked by their obstetrician to see a cardiologist for specific symptoms like shortness of breath or palpitations, or if they have a history of cardiac issues and they want them to be monitored during their pregnancy. In my opinion, patients should ask as many questions as possible when they come to see their cardiologist. The more they know, the better they'll understand their heart issues, and they'll also be able to understand the options that are available to them. If patients feel uncomfortable because of COVID coming into the office, I want to reassure them that we are following CDC protocols to keep everyone safe. Masks are required. We do try to do as much social distancing in the office as possible. And we also offer telemedicine visits if that's what you prefer. I want to know as much about the patient as possible, what they like, what they dislike, what's their lifestyle, what is going to work for them in terms of our treatment plan. And so I like to collaborate with them as much as possible and give them as many options as possible so they can choose what works best.